As we discussed about the labor and the stages of labor, in the second stage of labor, we have seen what are the events takes place in the second stage of labor. One of the major important aspect that we need to discuss is mechanism of labor that occur in the second stage of labor. So what is second stage of labor? It is from the full dilatation of the cervix until the delivery of the fetus. So from the full dilatation of the cervix, how does delivery takes place of the fetus? We will study with the help of a 9 cardinal movement that takes place in the form of a mechanism of labor. So what is this mechanism of labor? It is the series of events that occur on the head of the fetus during the process of adaptation through the birth canal or through the pelvis. We call it as mechanism of labor. So we will see with the help of pelvis and the dummy fetus where we will get engaged practically how these 9 cardinal movements, explanation of theory as well as how does it occur practically, we will see with the help of a demo. As you look at this demo of mechanism of labor, here we are going to discuss the mechanism of normal labor. So when I said normal labor, we have already discussed in the theory, there should be a true contractions given by the mother. We are not going to induce the labor. At the same time, there should be a cephalic presentation. A proper cephalic presentation means the head should be the presenting part or cephalic presentation, then only we can call it as a normal labor. So we will see the normal mechanism of labor. So what is the definition of normal mechanism of labor? A series of movements that occur on the head. Head is a cephalus. Okay, a series of movements on the head in the process of adaptation during this journey through the pelvis is called mechanism of labor. So what are the series of movements that occur during this journey as it is making a journey through the pelvis? We will see one by one what are those events or the movements that occur. So we call all together events as a mechanism of labor. So here there are important principles need to be followed. Before that, all the movements that are occurring by the fetus passively. So all these movements that we said, they are passive movements occurred with the help of a fetus, or fetus is moving forward through the birth canal in order to deliver out. So this is the definition of normal mechanism of labor. Then what are the principles we need to observe in the normal mechanism of labor? We need to observe, the first thing is descent. Descent means what? It is coming down. Okay, descent, which is a continuous process that will be there from the beginning of the labor. Descent is a continuous process that will be there throughout the labor. It is not one of the movement that occurred at one place, but it continuously moves. Like descent is what? The moving downward. It's like coming down. So as the fetus is started from the beginning of labor, it tries to descend even from the first stage of labor onwards. Second, whichever the part enter into the birth canal through the brim and touches the pelvic floor. Okay, the down we have a pelvic floor. So whichever the part that enter into the birth canal and touches the pelvic floor is the same part will rotate anteriorly. The same part will rotate anteriorly and become hinges under the pubic arch. So whichever the part that enter into the birth canal and touches the pelvic floor will rotate anteriorly and hinges under the pubic arch. This is the second principle that we need to observe in the mechanism of labor. And third is a continuation of second step, and whichever the part that enter into the pelvis also undergo underneath the pubic symphysis. Okay, this is the third principle we need to observe. So these are the 3 principles we can observe in the mechanism of labor. So other than that, there are important fetus in the utero terminology need to revised again here, which we've already discussed earlier, includes lie, position, presentation, and attitude, denominator. These are the 5 important factors to be considered. It's like a revision. We are going to see them before we discuss the mechanism of labor. So what is a lie? Lie is a relationship between the maternal axis and the fetal axis. That is maternal longitudinal axis and the fetal longitudinal axis. It is like a spinal cord of the fetus and spinal cord of the mother. Okay, so like that, the baby is lying in the womb in this way. So the normal mechanism of labor gives us the longitudinal lie, means the fetus is lying like this. It is parallel to the maternal spine. Okay, if the fetus is lying like this in this way, it is called transverse lie. And if the fetus is lying this way, we are calling it as oblique lie. So it is the maternal spine and the fetal spine both should be in parallel. That is a lie. Second one is presentation. So whichever the part of the fetus occupies the lower pole of the uterus, that becomes the presentation. So if the head is down, that becomes a cephalic presentation. If the buttocks are down, we call it as a breech presentation. So breech is an abnormal labor again or abnormal presentation. We are not going to discuss about the breech, we are focusing only on the head, that is cephalic presentation. Okay, and presenting part becomes the vertex. Okay, vertex is a portion of the head, we can see from the anterior fontanelle to the posterior fontanelle, we call it as a vertex. Okay, it becomes a presenting part. We can say cephalic presentation as well as the vertex presentation. Next one is denominator. Denominator is a bony prominent area which anchors the labor, which plays a major role anchoring the labor. So that is in the cephalic presentation, occiput. So we have bones, right? Occipital bone, we have frontal bone, we have parietal bones, and we have the occipital bone. It is not accurate the fetal head, but you can imagine in the fetal head we have all these bones. So occipitis is the above the nape of neck, we have the occipital bone, a prominent bone. So that is a occiput, denominator in the normal mechanism of labor. Next we have attitude. So what is attitude? The relationship of the fetus to its own body parts. Okay, so you can see this is the attitude. Attitude is the universal attitude is a flexion. Okay, there should be a flexion over the neck, flexion over the limbs, upper limbs, over the elbows, flexion over the hip, flexion over the lower limbs as well. So there is a complete flexion is a universal attitude of the fetus. So these are the important factors need to be considered. Let's move on to see the mechanism of labor. And before we see the mechanism of labor, there are, as I said, 9 cardinal movements we need to see. They are engagement, descent, flexion, internal rotation, crowning, extension, restitution, external rotation, lateral flexion and expulsion of the fetus. So these are the 9 cardinal movements we can see one by one. As we are discussing on the mechanism of labor steps, we need to look into the details that what are the circumstances which makes the normal labor is favorable. So we need to see that the engagement of the head should happen, the cephalic should be the presentation, and presenting part become either a anterior parietal bone or a suboccipital portion. Okay, that becomes a presenting part in the cephalic presentation. We can call it as a presenting part. Next, importantly, we also should consider, as we mentioned about the steps of mechanism of labor, position. So position is very different in related to the lie of the baby. Like if the mother is lying in the longitudinal lie at the same time, is it towards the right side or left side? Okay, so the positions are very different. What is a position? Position is the relationship of the presenting part of the fetus or the fetus related to the maternal pelvis. Okay, so in the position is the relationship between the denominator towards the maternal pelvis. So in the cephalic presentation, occiput is the denominator. Okay, so if the occiput is pointing towards the maternal pelvis of left side, we call it as left anterior position. Okay, and if it is towards the right side and it is turning towards the symphysis pubis, we are calling it as right anterior. Okay, and we said occiput is a denominator, right? So the relation between the denominator and the maternal pelvis, we are calling it as a position. So when it is left side and the occiput is a denominator, it is left occipito anterior. Then what does it mean by anterior and posterior? If the head is towards the symphysis pubis, we are calling it as, and this is anterior, and if the fetal head is towards the sacrum, we are calling it as posterior. So this is anterior and this is posterior. And if the fetal head, so if the fetal head is turning towards the symphysis pubis or placed towards the symphysis pubis, we are calling it as, this is left hip bone of the mother, so left occipito anterior, and this is right occipito anterior. So these are the left occipito anterior and right occipito anterior are the commonest positions. Among them also LOA is the commonest position we can see in the normal mechanism of labor. And we also have the posterior positions. We have the left occipito posterior and right occipito posterior as well. So this posterior position is again abnormal position. Here we are not discussing about it. We are focusing only on the normal mechanism of labor. So this is also one of the important consideration we need to see before we see the mechanism of steps that are happening. So that is one important consideration. Next one is engaging diameter. So engaging diameter should be the biparietal diameter. It is a horizontal diameter of the fetal skull. It is between the two parietal bones. Okay, so normally if I can show, this is my parietal bone. Okay, so in between the two parietal prominences, we have the biparietal diameter, which is of 9.5 centimeters. So this becomes the engaging diameter of the fetal skull in the first step. And coming to the engaging diameter of the maternal pelvis, it will engage in the transverse diameter or in the oblique diameter. So it may not completely snug into the transverse diameter. As we can see, the head get engaged. As we can see, the head get engaged in the pelvic brim. Okay, so we have to know even also the pelvic parts. So we have the brim, the first plane of the true pelvis, and we have the cavity inside, and we have the outlet, inlet, cavity, outlet. If you can just recollect the pelvic structure from the previous chapters. So it engaged in the pelvic brim. So what does it mean by engagement? The entry of the presentation or presenting part of the fetus into the pelvic brim, we are calling it as engagement in a simple step. So in the engagement, as we are focusing on according to the step by step of mechanism of labor of cardinal movements, here engagement is a first step. Engagement is the largest diameter of horizontal, which is a biparietal diameter, which enters into the transverse diameter or oblique diameter of the maternal pelvis over the brim. The largest diameter of biparietal diameter of the fetal head engages in the brim of the maternal pelvis in the transverse diameter or in the oblique diameter. So here the occiput is pointing towards the symphysis pubis, which is anteriorly, and the sinciput is more of a flexed way and facing towards the sacrum, or it is towards the sacroiliac joint. Okay, this is a position of engagement. And coming to the engagement here, as I said, the fetal diameter could be a biparietal diameter, which is of 9.5 centimeters, and the suboccipitobregmatic, which is of a 9.5 centimeters. So what is biparietal diameter? This is a biparietal diameter which is exactly placed in the transverse diameter of the maternal pelvis. And what is suboccipitobregmatic? Here, from the below occiput to the bregma. So this is placed in this way. Suboccipitobregmatic is the vertical diameter, biparietal diameter is the horizontal diameter. So exactly the vertex is a portion getting engaged in the inlet or the brim of the maternal pelvis. So as it get engaged, we can see there is a term called synclitism. So synclitism is a movement where as the fetal head is getting engaged in the transverse diameter, it is not exactly in the transverse diameter of the maternal pelvis. It can be leaned either towards the symphysis pubis anteriorly or towards the sacrum posteriorly. So when the occiput is leaning forward towards the anteriorly, what happens? This anterior parietal bone becomes the leading part in continuing the other movements of the cardinal movements of the mechanism of labor. As you can see, the asynclitism is a lateral leaning forward or a deflection of the sagittal suture. So we can see the sagittal suture also from posterior fontanelle until the anterior fontanelle. We can see it is between the two parietal bones. We can see that sagittal suture. So the sagittal suture is not exactly snugly fixed in the transverse diameter. Either it is leaned anteriorly towards the symphysis pubis or it is leaned posteriorly towards the sacrum. So this phenomenon we are calling it as asynclitism. So as it is leaning anteriorly, then the posterior parietal bone becomes the leading part. So we are calling it as posterior asynclitism. And as the sagittal suture is leaning posteriorly towards the sacrum, anterior bone become the leading part, and we are calling it as anterior asynclitism. Okay, it is simple way. If the sagittal suture is leaning forward anteriorly, the posterior bone becomes the leading part. The posterior bone becomes the leading part in moving the head. If the sagittal suture is leaning posteriorly, the anterior parietal bone becomes the leading part, and we are calling it as anterior synclitism. So that is a simple thing we can remember in the part of engagement. And as we discussed about the engagement happens between the 38 weeks to 42 weeks in the primigravidae and just before the first stage of labor in the multigravidae. So that is about the engagement.